and 2 months.
I'm gonna do it too, so I can get on and read this.
The moral reflex is stimulated by holding the infant in a semi-seated position. The examiner supports the head in midline with one hand and the infant's back with the other hand. She allows the child's head to drop backwards a few centimeters. The sudden movement backwards into space sets up a startle response in the child. An intact response shows abduction and upward movement of the arms at the shoulders, with extension of the elbows and fingers as the hands open. The outward movement is followed by adduction and flexion of the upper extremities and movement back toward midline. The response of the lower extremities is toward flexion. This reflexive response to sudden changes in body position may serve to alert the child's caretaker that he may be in danger, and establishes part of the communication between the caretaker and child. This reflex is most active at 2 months and is usually inhibited by 4 to 6 months. The examiner inserts a finger into the infant's hand from the ulnar side and presses against the palmar surface to elicit the palmar grasp. The desired response from the infant is strong flexion of his fingers around the examiner's finger. The duration of this response is up to 2 months of age. The examiner stimulates the plantar grasp by applying pressure to the sole of the foot. The infant responds with strong flexion of the toes, as if to grasp the examiner's finger. The flexion response is stronger when the foot is dorsiflexed. This response lasts up to 12 months when it is inhibited by weight bearing through the feet in standing. Plantar and palmar grasp are strong flexion responses to tactile and proprioceptive input on weight-bearing aspects of the hands and feet. These responses are consistent with the infant's overall state of physiological flexion. The grasp reflexes persist until they are integrated and modified by weight bearing through hands and feet. To elicit the primary standing reflex, the infant is suspended vertically with his trunk supported under the arms. The soles of the feet are brought into contact with a hard surface. The infant's reflexive response is to bear some weight through his feet. At this stage, hips, knees, and trunk are not fully extended. Primary standing is present at birth, persists to about 2 months, and then gradually disappears. The placing reaction is seen at birth and persists until 2 months, when it is gradually inhibited. It is elicited by suspending the infant vertically and moving him so that the dorsum of the hand or foot contact the under edge of the examiner's table. Upon stimulation of the dorsum of the hand, the wrist will extend and the palm is placed on the table. This reflex forms a sensory motor preparation for more active weight bearing and weight shifting in crawling and walking. Upon stimulation of the dorsum of the foot, the infant's response will be to flex the hip and knee, lifting the foot above the table, and then to extend the leg, putting the sole of the foot on the table.